I have worked as a licensed practical nurse at the Florida Department of Health of Bartow, where they specialize in HIV and STD. In this clinic, I learned a lot about HIV and noticed that many people are not well informed about it. HIV does not discriminate against age, gender, or race, and that is why it's vital for everyone to know about it. I will discuss HIV's cause, symptoms, treatment, and prevention in this presentation. According to the CDC, HIV, known as human immunodeficiency virus, attacks the body's immune system, and if left untreated, it can lead to AIDS. HIV does not have a cure. However, with effective treatment, a person can live a long and healthy life. According to the Florida Department of Health, there is 120,502 people living with HIV in the state of Florida, and out of those, 95,959 are in care, and 88,274 have stayed in care, and 83,556 have a suppressed viral load. According to the CDC, HIV is transmitted through sexual contact, sharing needles to inject drugs during pregnancy, birth, or breastfeeding. However, it's not transmitted through the air, water, saliva, sweat, tears, or closed mouth kissing, or through insects, pets, by sharing toilet, food, or drinks. The CDC mentions that the only way to know your HIV status is by getting tested. The CDC mentions that usually symptoms are presented as flu-like symptoms within 2 to 4 weeks after infection. Some people may not have any symptoms. According to the CDC, symptoms may vary depending on a person. It can last from a few days to weeks. The symptoms that a person may present, according to the CDC, are sore throat, fever, swollen lymph nodes, a rash, muscle ache, fatigue, chills, mouth sores, and night sweats. The treatment for HIV is antiretroviral medication. According to the HIV.gov, antiretroviral controls the virus and it is for everyone. HIV.gov mentions that the initial treatment for HIV is usually 3 HIV medication. A combination of HIV medications is known as HIV treatment regimen, according to HIV.gov. HIV.gov mentions that there are several options to combine 2 or 3 medications into one once-a-day tablet. In addition, it mentions that there is a long-acting HIV medication injection that can be given every 2 months if approved by their healthcare provider. HIV medication reduces HIV in the blood, known as the viral load, to a very low level. A viral suppression means that the person has less than 250 copies of HIV in their blood per milliliter of blood. In addition, it also HIV.gov mentions that undetectable level of viral load means that the person standard test cannot detect their HIV in their blood. If HIV were left untreated, it can lead to life-threatening infections and cancer. There is actually medication to control this type of infections. In the clinic, I noticed that many people may stop their medication due to side effects. Usually the side effects are nausea, vomiting, diarrhea, difficulty sleeping, dry mouth, headache, rash, dizziness, fatigue, and pain. However, a patient should never stop their medication and should consult with their healthcare provider. Skipping doses, starting and stopping medication can lead to drug resistance. Ways to prevent HIV is by using condoms. This is a male condom. This is a female condom for vaginal sex. This is a oral damp for oral sex to the vagina or anus. And there is also oral condoms. In addition to that, you should not share needles and should get tested frequently if you're at risk. In addition to that, there is also a medication known as PrEP, which is pre-exposure prophylaxis if you're at high risk, and should discuss this with your healthcare provider. In addition to that, there is PEP, which is post-exposure prophylaxis that should be taken within 3 days of exposure. I hope this presentation helped you learn a little bit more about HIV's cause, symptoms, treatment, and prevention. Take care of yourself and others. Thank you.